hear me now. The symptoms that women are associating with menopause are really those of estrogen and progesterone deficiency. It's just people say, oh, menopause is causing this. Menopause does not have symptoms. Menopause is a symptom, just one more symptom of estrogen and progesterone deficiency. And women, if we can understand this, then now we can actually open our minds to, oh, then we can prevent it. And women who are realizing this, who've already experienced menopause, they have a pretty good chance of being able to reverse it. Hello, everyone. You're listening to the Menopause Moxie podcast, where we strategically challenge the status quo on perimenopause, menopause, and female hormone balancing. I'm Marie Hoäg, and I'm here with my co-host and producer, Maggie Kuhn. Welcome to the show. I was told my menopause was inevitable, that it was something that I would have to deal with as I age. In this episode, I share how I reversed my own menopause and why, with the right hormone replacement therapy system and protocol, I'll never experience menopause again. I'll also explain how advanced HRT restores a woman's full physiologic rhythm, reverses menopause, and redefines what's possible in women's mental and physical health. Welcome to the show, Maggie. Nice to see you.
Great to see you, Marie. So, last episode, we were talking about preventing menopause, and today we're talking about reversing it. Can you talk right away just what is the difference between those two concepts?
Well, if a woman wants to prevent menopause, the best time to do that is when women start to notice that her periods are irregular, consistently irregular. And when she's decided she's finished bearing children, that's the best time to prevent menopause. These are women who are still menstruating. Reversing menopause is where women have already experienced menopause. They haven't had a regular period in 12 consecutive months, and they're in one of the three stages of postmenopause. So one is still menstruating, and the other group of women, they no longer menstruate.
Okay, so just to level set here in this episode and make sure we're all using the same terms and definitions, I'm going to ask you a few questions that I'd love for you to answer. So, starting with, what is the current mindset about menopause?
Well, the menopause movement, we did a podcast on that, and I wrote an article about that. Is menopause is something that the mindset is that menopause is something that every woman has to go through at some point in her life. It is as if it were a set of symptoms, if it were a condition that we're all doomed with, and that it needs to be managed with things. So women will experience horrible symptoms, and then the rest of her life, she will need to manage those symptoms of menopause.
Okay, so it's menopause is inevitable. It's
Mhm.
part of aging. Tough luck, sister.
Yeah.
Um, manage it, and here's how. Okay, so what causes menopause?
Well, there are different schools of thought to this, but it depends on how you look at menopause. And if menopause is looked at as the hormone deficiency disease condition that it is, then estrogen deficiency is what causes menopause. So you need both estrogen and progesterone to regulate a healthy menstrual cycle. When these two hormones get too low, then that causes dysfunction in the menstrual cycle, and then it eventually stops. If you look at menopause as a side effect of hypoestrogenism, well, then now you can do something about it. You can restore estrogen in a way that sends signals to your brain that you're really in your reproductive prime, not aging out. So the short answer to what causes menopause, estrogen deficiency. No woman with plenty of estrogen has menopause, no matter how old she is.
So just to clarify again, so if someone's still having periods, even if they're spotty and sporadic, that's perimenopause. Menopause is the 1 day anniversary of 12 consecutive months of not having a period. And then everything after that day is postmenopause. Is that correct?
That is correct. And any time beyond that is considered postmenopause, of which there are 3 stages.
Okay. And we'll talk about that, I think, in a minute.
Mhm.
What is the conventional approach to menopause right now?
For right now, the standard of care to treat menopause in women is to prescribe, at least this is frontline therapy now, first line therapy is prescribe hormone replacement therapy, but at low doses. So women get low dose hormone therapy to manage the symptoms of hormone deficiencies. So it's about managing symptoms. And then when the hormone therapy stops working because it's low dose, women need more than this low dose. They'll need other things to help manage the symptoms of menopause because they're taking low dose. So psychotropic drugs, treatment, surgeries, other things. But the mindset is let's manage the symptoms with all these other costly things. And
Hmm.
so now that's how women, when they go to a hormone doctor, no matter how popular they are, no matter how famous they are, no matter how active they are on social media, these doctors prescribe low dose hormones that actually keeps women in a state of menopause. And this is unfortunate for women because they think they're going to menopause specialists. In reality, they're menopause management specialists.
I think that's a really important distinction, Marie. And I've talked about before that, I thought I was being really proactive with my health by being on HRT, which I've been on since perimenopause. So, that was good, but it was all low dose and it did stop working. And there were times when it felt like I wasn't on HRT at all. So, really, that distinction that you just said helps me understand. I'm sure a lot of our listeners and viewers understand that perhaps what's happening for them, even if they're on HRT, is it's just management, symptom management. It is not addressing the root cause and issue.
Yeah, I went down that road for so long. I mean, my cocktails of psychotropic drugs to manage my, especially my estrogen deficiency symptoms. I mean, and the side effects I got from those drugs, it was a horrible life. The expense of the medications, the expense of the supplements that weren't working, the low dose hormones. I mean, it's just not a good, it's not a good model for the patient. It's a good business model for the prescriber and the people on the team making money off of women suffering. And that's, as you know, why I do this, because I do think this approach that women are sold as the gold standard of female hormone balancing is really just a racket. And I know I've lost followers because I've said that, and that's okay. But a part of what I'm aiming for here is to educate women that they have more control over whether they experience menopause at all. And if it makes sense to women, then great, I'll help you out further. And if it doesn't make sense, then it's probably won't work out. Yeah, because there's a lot of negative, still a negative viewpoint towards estrogen and how much estrogen women really need.
So, why would a woman want to reverse menopause?
Well, it's not so much about restoring a menstrual cycle or reversing the menopause, so to speak, but it's how women feel when they get enough estrogen and progesterone that actually regulates a healthy incident-free menstrual cycle. The menstrual cycle is really the side effect of having enough estrogen and progesterone. It ends up being a mere inconvenience, but it's a menstrual cycle that doesn't have PMS, PMDD, those also common symptoms that women get right before they start their period that we're told we have to live with. Oh, well, it's normal. Everybody gets it. And we all accept that. And this is what really irritates me because I spent so many years with PMS and then later on PMDD and at one of my mental illness diagnoses, and I bought into this and it affected my life greatly. I just think women, the more they understand about how this works, the more control they can have. Like, I cannot imagine ever going through menopause again, ever. And it's been so life changing for me. In fact, honestly, life isn't worth living in menopause. And it's like if you take my hormones away, I don't feel good with trying to get symptoms management for hormone deficiencies that wouldn't exist if women got enough hormones.
So let's talk a little bit further about the benefits of estrogen. So the what I just heard you say is that a woman would want to reverse menopause for the benefits of it, and a side effect will be that she gets a period again if she has a uterus. So, what are those benefits of estrogen? What are the selling points here?
Well, I think what I've seen just clinically over the past couple of decades with women, and then going through this myself a couple times, I've been in and out of menopause a couple times and will never go again. It's the mental illnesses that disappear. I mean, my mental illnesses were controlling my life. I mean, I felt horrible every single day, and that affected my moods, and then that affected my responses to the people in my life. It affected my decisions. It just affected everything, my relationships with my husband, my children. I mean, what would my life be like if I wasn't so just dragging my knuckles and feeling like I just want to die all the time, you know? And then so experiencing that was just so monumental for me that I just like, this is crazy how we're keeping women in this state of hormone deficiency when it's just life changing. A woman can be who she really is authentically when she has enough estrogen, because now she's not fighting all these other things constantly in her head, and the negative ruminating thoughts and the feeling, you know, the fatigue. And so the biggest thing really is the mental health benefits, but also the physical benefits of the lack of physical pain, the fibromyalgia that no longer exists, the joint pain that I haven't experienced since week 2 on fourth generation HRT, and the ability to sleep, the ability to make, you know, connections, emotional connections with other people. Those are so beneficial for my family, my children, my work.
I think there's a lot of things that are going on as perimenopause is, getting further along, heading towards menopause and into postmenopause, that women may not realize are an effect of low estrogen. Things like anxiety, things like joint pain, things like sleeplessness. This is all related to estrogen deficiency.
Yes, and this is a good place for me to really emphasize, hear me now, the symptoms that women are associating with menopause are really those of estrogen and progesterone deficiency. It's just people say, oh, menopause is causing this. Menopause does not have symptoms. Menopause is a symptom, just one more symptom of estrogen and progesterone deficiency. And women, if we can understand this, then now we can actually open our minds to, oh, then we can prevent it. And women who are realizing this, who have already experienced menopause, they have a pretty good chance of being able to reverse it. And that's what we'll talk about here, is getting women enough of the right hormones. And as you know, you hear me mention the hormone sweet spot. The hormone sweet spot really is that when you get estrogen and progesterone and all the other pertinent hormones dialed in, each hormone has its own reference range where that hormone performs its best. And when all the main sex hormones are performing at their best and they're working together in an orchestrated way, then women don't have the symptoms of hormone deficiencies. So that's why we monitor clinical indicators in lab work so that we get the hormone sweet spot. The hormone sweet spot is a place of true and optimal hormonal balance where a woman cannot imagine feeling any better than she does, and her lab work concurs with how she feels. It is a clinical destination, and there is a technique and a process to achieve that. And there's just some information that women need to know to learn to see, one, is this a good thing for them, or and you know, what does this whole thing look like?
Well, and that's what I want to ask you next. So, if the hormone sweet spot is a destination, and that's one of the differentiators of your approach,
Mhm.
if this is a destination, what's the roadmap to get there? Is there one?
Well, there is, because it isn't just about hormone replacement therapy. Like I was one of those patients where I didn't want to make any sort of changes in my life. I was just like, just give me the hormones. But hormones need a relative healthy body to function. The healthier a woman is, the better the hormones work. And so the first step, so there's about 5 steps of reaching the hormone sweet spot. The first step is you really need to find a hormone doctor who is trained in advanced therapeutic dose HRT protocols. If the doctor is not trained on the technique and the process of achieving the hormone sweet spot, then it will be like being on an exercise wheel, constantly trying to manage symptoms with no destination in sight. There is a clinical destination of hormonal balance, and if your doctor is not trained in this, it will just be like a crapshoot. So, at first and foremost, the doctor has to be trained in advanced protocols and have clinical experience. Because just because the doctor is trained in this, it truly does take practice for the doctor to really see how this protocol works from a clinical perspective, not just what they've been told in their ear, but what they see in front of them clinically with their patients. And the longer they do this protocol, the better they get. So there is a learning curve to it, but it's super critical. You can't go to a doctor that's not trained in advanced HRT and expect to reverse your menopause. It just won't happen. The second step is, well, the hormone replacement therapy itself. As you know, we just did the podcast on the 4 generations of HRT. Not all HRT is the same. You can't restore a healthy menstrual cycle with first and second generation HRT protocols. It doesn't work. They're very limiting. Those protocols may be good for some conditions, and we do use those. We don't use oral estrogen, but we use second generation HRT systems for, a very particular case by case basis. But for the most part, women need an advanced HRT protocol designed for full restoration, not just giving women minuscule dosages to shut her up, say, okay, well, you're on hormones, honey, stop complaining about how you feel, buy this supplement, it'll make you feel better. That's really what's happening right now. This is why it's important that you need a protocol that's actually designed to restore full function in the brain and body.
And that's a difference between full restoration and replacement.
Oh, very much so. First and second generation protocols, just a thumbnail sketch, are designed to keep women in a state. And so second generation is like patch therapy, bioidenticals. Those types of hormone therapies are designed to only get estrogen in really the lower third of the standard reference range. Was women feel a little better, but they still they're still dragging their knuckles all day long with low energy. They still don't want to be touched in bed. They still want to avoid situations because they can't cope for one more day. And then they're drinking, taking drugs, trying all these things to help themselves feel better. And it's just, like I said, that's a part of the exercise wheel of symptoms management with low dose therapies. So yeah, the second step is you have to take an HRT protocol that's designed for full restoration. And that's why it's important to go to a doctor who's trained, because they'll know how to prescribe this protocol. The other thing is hormone therapy does not work alone. You cannot just take hormone therapy and think everything is going to be hunky-dory. A patient has to eat the right diet, the right foods to support the hormone therapy, to allow it to work as a therapeutic tool. So that means a good farm to table diet with plenty of clean meats, uncured meats, raw dairy, plenty of saturated fats, and fermented vegetables in with this mostly carnivore diet. This is the diet that tends to work well for most women. It actually took my hormone therapy to the next level when I started focusing more on a carnivore. I'm about 80% carnivore. And since I've done that, that's actually taken my protocol to the next level. It performs better. Step 4 in all of this is the hormones need to be circulated. You can't just take an injection of estrogen or take a hormone and sit around all day. Those hormones need to be distributed throughout your body so your body can benefit from it, and so your brain can benefit from it. That means there needs to be some sort of daily exercise and a good 3 to 5 days a week of getting the heart rate up so that you're breaking a sweat. And so as your body is circulating these hormones, women will feel better. And then when they incorporate the good farm to table organic diet, then those two things help the hormones work better. And it's noticeable. And then the last thing is sleep. And I know everybody talks about, oh, you need more sleep. Well, that's such a big joke when you're telling a menopausal woman she needs more sleep. Don't you think I want more sleep? I mean, it's like if I could, I would. So I think it's so funny when I read these things. Oh, these steps to navigate your menopause. Make sure you get plenty of sleep. Estrogen deficient women don't sleep. Menopausal women don't sleep. It's very difficult for a menopausal woman to get in her stage 4 sleep where she wakes up feeling rested and ready to take on her day. So what's nice is when you bring on the advanced HRT protocols, women are now able to sleep. But it's when women sleep that's really important. Sleeping when the sun is down. Graveyard shift nurses don't do as well on this type of protocol because it really it messes up their circadian rhythm. And this protocol builds the circadian rhythm. And if a patient is doing something that's out of that rhythm, then the patient doesn't get the full effect, the full benefit of what the protocol offers.
So you've just given us the 5 steps to the hormone sweet spot, and this is not an overnight change, correct?
Oh, no. Yeah, this is very much a transformational journey. This isn't just slap a patch on and talk to the doctor in a year. When a woman takes therapeutic dose HRT, it does something that no other protocol does. It actually wakes up the brain like nothing else. And when this happens, women start to feel alive. That's a word that's used a lot. I feel alive, like for the first time. I don't know if I've ever even felt like this before, of being alive. And as this happens, as each day passes, women feel better and better. And because they feel alive and they feel good, their responses to their daily life changes. Instead of being reactionary towards things, they're more calm and sit back and analyze and respond appropriately. And this actually changes a woman's life, if just this alone. And not only that, the mental illnesses that women are diagnosed with, especially the hormone deficiency induced mental illnesses, they start to go away, and lethargy and apathy. And this happens over time. In fact, as each cycle passes, the woman feels better than the cycle before. So over time, women are changing so much for the better. The pain is going away, their brain is coming back, the mental illnesses are going away. And then women start to depend on this, that they know when they wake up in the morning, they know that they're going to feel good all day long. And just this self-reliance alone gives women peace and hope for the future. It's like, and they get creative. I'm like, oh, I've always wanted to start my own business. And then now they feel capable of doing it. And then they can project and look in the future and say, okay, well, I'm going to put together a plan because now I feel capable. I don't feel like now I can't take on one more day or one more thing in my life today. So over time, this is a transformational journey, and it works in 3 phases. And it took us a while to learn about these phases. But in these 3 phases, it's pretty predictable what a patient will go through. And this is what doctors will learn when they are trained in advanced HRT. What happens in the first phase, what happens in the second phase, what happens in the third phase, how to prescribe those hormones that actually takes the patient through this process. So the goal through this, it's really, we're trying to achieve optimal hormonal balance through this phasic journey. So as each phase happens, women have more and more hormones that allow their brains and bodies to work better.
And again, this is a woman who's postmenopausal. She has stopped having a period.
Okay, so we start them off on a low therapeutic dose. It's in the therapeutic range, but it's on the lower end. So we can see how the body responds and what we were able to yield lab-wise with that dose. During this particular phase, a woman is building receptors so she can actually adapt to this estrogen so she can benefit from it. And so as each cycle passes off this first low therapeutic dose, it will take about 3 cycles for the body to adapt to this full dose. So there's no hormone adjusting because the body, it takes about 3.5 to 4 months for the body to get that full benefit. And then at that point, we learn that the patient may need more hormones. So there's another dosing adjustment. But in this first phase, our goal is to build a foundation of main sex hormones, starting with estrogen and progesterone. Those are the 2 main sex hormones that allow a woman to regulate a healthy menstrual cycle. And those hormones are administered in a way that replicates a healthy menstrual cycle. Estrogen is maintained in a certain lab range, and progesterone is cycled days 14 through 28 at a particular dose. And this actually sets the circadian rhythm and it sets the menstrual cycle so that in time the body catches up to it. And then later in this phase one, which is about 4 to 6 months in this phase, towards the middle or late part of this phase, the uterus is starting to wake up. See, the organs and tissues start to wake up and want to heal and repair and regain function and the processes of the body, including the menstrual cycle. So the uterus comes back to life. And so women will go through a type of puberty in this area. So that when, just like in puberty, as the body is gearing up for a young woman to be in her reproductive prime, the body is adapting to the estrogen and progesterone that she's taking. And as her body adapts, it wakes up her uterus and it wants to have a period. And so in the first phase, we see kind of a sputtering of a period, kind of a light flow, a couple days, nothing too major. And then as each month passes and the body adapts to the hormones, then the body continues to regulate itself. And this is how the body heals over time. And it's noticeable through the menstrual cycle. And then so this is actually the first taste here. And then so women start to get used to, oh, I'm having a monthly period, but my brain is working. My body is in less pain. I'm sleeping at night. Oh, I have a libido. I have energy. I'm happy. And this is what women typically experience in the first phase. At the same time, a woman is feeling good on her low therapeutic dose. We call those positive clinical indicators. She can also have some negative side effects that we refer to as negative clinical indicators. A woman can have both. So when you give a low therapeutic dose to a woman who doesn't have enough receptors for that dose, well, the way to build them is to give them that dose. And so the body produces those receptors, and that's why women feel better. But this is also what helps regulate the menstrual cycle. So in this phase, women can experience positive clinical indicators and negative clinical indicators. And it's something that's to be expected. We're expecting it. So when a patient is prescribed a therapeutic dose HRT, we are expecting breast tenderness. We're expecting gut bloating, especially the more severe gut dysbiosis the patient has. We're expecting some water retention. And at the same time, a woman can feel on top of the world. This is why we monitor clinical indicators when we adjust hormones. A part of this journey, especially in the first phase, is you will experience positive clinical indicators and negative clinical indicators. But the negative clinical indicators are extremely tolerable, especially when you're feeling so good. It's almost like, for me, it was like I didn't care that my boobs hurt. I just felt so good. And I knew they would go away because my coach told me they would. I mean, I was being coached through this process, which is now I understand why coaching is a thing through this process. And then that just goes into phase two. Phase one, our goal is to build the estrogen and progesterone, the main sex female hormones. Phase two is really designed to fine tune other hormones. So now we have a foundation of estrogen and progesterone. And though levels still aren't optimal at this point, there's enough of these hormones that we can possibly introduce other hormones if indicated. So we do retest testosterone at this time because estrogen and progesterone, especially estrogen, influences the production of other hormones. So we get a better picture when we retest at this time to see what did estrogen influence with regards to these other hormones. Did we get an increase in testosterone? Did this foundation affect thyroid? This gives us a better picture of, do we even need to bring on any other hormones? Did we optimize testosterone just by optimizing estrogen and progesterone? And if a doctor doesn't understand therapeutic dose HRT, they won't know to look for these things. Doctors who don't have this training and don't do this, they just start handing any hormones out, hoping that they're going to hit something, that something's going to stick and work. It just doesn't work that way. You can't overdose a woman with another gender's hormones as a foundation and expect her to feel good. And you certainly won't recreate that menstrual cycle. But this is where the fine tuning happens. And it's in this phase where the menstrual cycle now levels out. It turns into a more incident free, where there is no cramping, no PMS, no headaches, no pelvic inflammation, no mood swings. So we use the symptoms of PMS to know whether we have estrogen and progesterone dialed in. And that's what we fine tune in this phase. Does the patient still have any symptoms, any negative clinical indicators that we can adjust a hormone? See, this fine tuning phase is very similar, as you've heard me say many times, Maggie, that it's like fine tuning a piano. You get the patient into the optimal range, and then now you're fine tuning of what these levels are, very particular to this patient. And that's where the fine tuning comes in. The goal first phase is get the patient close to the optimal range, where we know that most women do best. And then when they get into that optimal range, fine tune all the hormones that are needed, that are specific to the needs of this patient. And then in this, the goal is really to orchestrate, to optimize all of these hormones to their optimal levels, and then have them work together in this well orchestrated rhythmic symphony that the entire body is responding to. The digestive system, the cardiovascular system, the menstrual cycle, all the processes in the female body are dependent upon this activity here, that women are now controlling, and not their body itself. This is why it's important when you do this kind of hormone therapy to understand that this is a transitional process at your hands, and that everything in your brain and body is depending on you to get this right. That means you have to go to somebody who knows what they're doing. It's not a crapshoot. And you have to take the hormones as prescribed, because there is a technique and a process. And if you go online and think that this may be better for you and you change your dose in the middle of it, now you're off the protocol. And now your journey is different. And now your circadian rhythm is messed up. So it's really important to understand. And that's why when I coach patients during this process, it's like, listen, you are now at the helm of your entire body, how your brain works, how everything in your body is functioning, to the point of whether you can take a deep breath or not. And so it's really important that women know that, yeah, you are now the master regulator of your entire brain and body. And this phase here, this particular phase, can last about 6 to 9 months.
And this
It
is
just,
still the second phase we're talking about.
yeah, still in the second phase here of fine tuning everything. And then towards the end of this phase here, the patient's really close to the sweet spot. The labs, all the labs are in the right range. And you can get that in the second phase, that the labs will be in the right range, but the brain and body hasn't caught up with that. And so we can get all the hormones in the right range. And then the phase 3 really is, okay, we have you here, hormone sweet spot. And now this is really when the work begins of the hormones. Getting to the hormone sweet spot is one thing, hormonally speaking, lab-wise speaking. But now the brain and body, for the next 12 to 18 months, will continue to benefit off of this dose, these levels, for months. 12 to 18 months is pretty much the average, where every month the patient is on these hormones, she feels better than the month before. The brain works better. The woman feels happier. She's making connections. So phase 3 is we really want to get women in their hormone sweet spot, where they can't imagine feeling any better than they do, and their lab work is in the optimal range. And this is the definition of the hormone sweet spot. And the goal is to maintain this for life. And if a doctor isn't trained, they don't understand this sweet spot and how to know when that patient is here. And it's very important to know if you're in your hormone sweet spot, because we want to make sure that the hormone deficiency related mental illnesses go away here. And so if a woman have mental illness caused by other things, well, it could be addressed. But most of the mental illness that women suffer with to this day, probably 80 to 85%, is a hormone deficiency induced mental illness. And that's the beauty with this, because as women go through this, through the second phase and then even into the third phase, it's like, okay, so I don't have mental illness. My life was dictated by it, and now it's completely gone. And so now part of this transition that women go through is they start to transition into becoming the woman that they know that they could be and should have been, but were kept back because of how horrible they felt mentally and physically, which impacted how they behaved and the decisions they make. Because I tell you something, Maggie, a woman, when she makes a decision, like say an important decision, whether it's for her career or her family, important decision, those decisions will reflect her hormone levels. If she is estrogen deficient, her decisions will be different than if she had a full tank of estrogen. And this changes a woman's life. It changes the complete trajectory.
Okay, so you've just shared this three-phase process and a couple of comments. One thing that I'm really hearing is the expertise, that there's just no substitute for the experience and the expertise that you have with several decades of doing this and the doctors that you work with. Uh, to know what this destination is, to know there is a destination of the hormone sweet spot, and then how to get there is not widely understood. So it's pretty detailed, and at the same time, what I'm also hearing is that women need to be patient through this process because you're going to start hormones. You're going to think that you're going to feel great, and maybe you do, but you may also have some negative clinical indicators. One of the things I see all the time in these social media chat groups is, my breasts are sore. What do I do? And then 10 people chime in, 100 people chime in, do this, do that, change that, change that. Women are changing and futzing around with their hormones, it seems, all the time. So they get a little bit of a negative in, I'm bloated, I'm putting on some weight. Well, then do this. And 20 people weigh in. It's You can't be futzing and adjusting is what I'm hearing. That you have to stick with this and resist that temptation. And that is a critical part of having a coach through this. I can attest to this because I'm coming up on a year. So I'm at the end of about phase 2. And I can attest that I've been feeling better and better. I can attest that I'm feeling healthier and healthier. I can also attest to the fact that in the beginning, I did have negative clinical indicators as well as positive. And if I had been left to my own devices, I would have been futzing around with my levels, trying to change them and figure out what made me feel better, not understanding the process you just described, that this is months, even years long to get to your final destination fully. And so goofing around with your dosages in between, and doctors, I think, even do this too, because they don't know and they're
They don't
just
know what
trying
they're
to
doing.
respond to the patient.
Yeah, they don't really know what they're doing. It really is a crapshoot. That is really not an understatement. And luckily I had a coach. I mean, I was one of those women who were listening to other people. It's like, okay, well, my boobs hurt. One of the negative clinical indicators is sore breast. And so I thought, well, I'm going to lower my estrogen because my boobs hurt when my estrogen is high. So I lowered my estrogen. And this is really before we knew how important coaching was. And then I started being coached by Dana Nelson, who was a pharmacist I was working with at the time. And if it wasn't for him, I mean, because I'd be on the phone complaining about my boobs and how much they hurt, but yet how good I felt. And he said, you know what? Listen, Marie, he says, you just need to get over this hump of the sore boobs. It will go away, but you have to do this. And the reason why your boobs hurt is because you don't have enough receptors for the amount of hormones you've given yourself. But you have to give yourself a slightly higher dose for your body to upregulate those receptors so that those negative symptoms go away. If you lower your estrogen or only take half of your daily dose, then now you've messed up the entire protocol, the rhythm that we're creating. And when he explained that to me, I was like, oh, well, oh, so when is my breast tenderness going to go away? Well, it's going to go away next week. And it's going to go away next week because your estrogen's going to. So he explained to me, and that really did it for me. I'm like, okay, so that's when we really brought coaching on in the clinic, and we hold the patient's hands through this process. So there's never a question on the patient should not have to figure out their own medical care. I mean, I just think it's ridiculous that doctors are practicing this kind of medicine without any sort of training at all and treating women as if they were just, okay, you want this, take it. You want this, take, and they don't even know what they're doing. I mean, they could really cause a lot of problems with mental illness in women and some side effects.
I wanted to raise one other thing that, and just kind of pull it out of the three phases that you had talked about, which is starting with estrogen and progesterone and getting those optimized first. Because
Yeah.
what I also see a lot of is people starting out with progesterone, estrogen, and testosterone, and sometimes just testosterone, and and then they're monkeying around with all these different things, and they don't know which lever to pull to straighten things out. Can
Yeah,
you
that's
talk
a
a little
good
bit more about what the philosophy is of starting somewhat simply and then moving through?
well, it's actually a requirement to get it right. It's so important to start with the main sex hormones of whatever gender the doctor is working with. If it's a man, then start with testosterone. Don't just load a guy up with estrogen and call it good. That's just ridiculous.
Does that
Start.
happen?
Oh my gosh, yes. It's like, oh, you don't need testosterone, you need estrogen. I'm looking at these estrogen levels. I'm like, who are you going to? Does this doctor have any training? Now, testosterone is a man's main sex hormones responsible for just about influencing everything in the male body. Why are they loading? No wonder why you're crying all the time. And the women, it's like they're put on testosterone and first and foremost, and they're loaded up. And any estrogen a woman was producing, it really shuts down her production. And now she's feeling the side effects of estrogen deficiency. But yet there are some feel good benefits of testosterone, but that's short lived. And part of this higher dose of testosterone, what these doctors don't realize they're doing is they're putting the patient in a slight stage of transition. So you're transitioning genders here, but at a low level. And women just don't feel good here long term. And so it's super critical to start with estrogen and progesterone first so that you know what these two hormones are able to do. And then you look at if the patient still has negative clinical indicators, you take a look and say, where are these? What are they? And is there another hormone deficiency that can be contributing to this? And then you bring that on, but you can only bring on one at a time. You can't just throw everything out there and hope it's all going to stick, but because you're not going to know what did what. So you start with the two main sex hormones for women, estrogen and progesterone. Then you reassess and say, okay, is there anything else going on? Any other negative clinical indicators? Especially when you know you have the estrogen and progesterone dialed in just right. And then you bring on the hormone. You start at a relatively low dose. You see how that hormone works with estrogen and progesterone, and then you dial that in. And then you see if that does the trick. If it makes the patient feel worse, then that's not a hormone that was good to bring on. So you let go of that and reestablish the foundation, and then possibly try another hormone if indicated. But for the most part, for women, if you get the estrogen and progesterone dialed in just right, the need for other hormones is not really necessary. But some women will still need thyroid, testosterone, and some occasionally cortisol. But for the most part, dialing in estrogen and progesterone and physiologically dosing testosterone is a good combination for women to just feel good for no real good reason for the rest of her life.
So, but again, I'm really hearing what you're saying about patience that's needed through this process. And again, I can't speak highly enough about the importance of a coach through this because it is just too tempting to try and futz around yourself, or to crowdsource through social media and get 100 different people giving you 100 different answers and trying to figure it out yourself. That's not a good way to be approaching this absolutely critical aspect of your health.
Part of my job as a clinical hormone coach is, in my mind, I have got to educate this patient, with as much knowledge as I have, because this is something they're going to do the rest of their life. So they need to understand why their body is functioning the way that it is, why we're bringing on these hormones, what we're doing during these phases. So a patient knows at every place during this transition where they are. There's never a guess. Everybody on the team knows, the HRT prescriber knows, the hormone coach knows, everybody knows where we are and where we're going, and everybody's trained on the same technique. So it's not like, okay, so what are we going to do today? I don't know. How do you feel today? I mean, it's just like that is right now how women are treated. And I aim to change that. I really want to change that. I want doctors to have this education and women to have access to these physicians and access to the hormones. And so as a coach, my job is to, and you probably heard me say this to you before, it's my job to tell you all that I know so that you can do this without me. You're going to someday not need me. And that's my goal, is to coach you so that you don't need me. And so there's a lot of education in our program, not only with diet and lifestyle and what the best protocol is for that, but about HRT itself, so that when a woman feels negative clinical indicators, it piques her to think, oh, is there something going on with my estrogen? It's usually the first hormone we take a look at. And then we draw blood and say, okay, well, yeah, it looks like these symptoms may be related. Your estrogen tanked. Why is that? Then we take a look at what would cause this estrogen to drop. And then we would try to avoid that, and then we would readjust and bring those hormones back into alignment. And this is how the maintenance works long term for the rest of a woman's life, preferably. I know that would be the case for me.
So we talked about the 5 steps to the hormone sweet spot and then the 3 phases of the journey to the hormone sweet spot. When is the best time for a woman to reverse menopause?
Yeah, so yeah, reversing menopause is, you really want to start hormone therapy long before menopause. And I'll just say this, as you heard me say, even in the preventing menopause podcast, is women want to start HRT in stage 1 perimenopause. Now, as you know, and you've heard me explain, that there are 10 stages of a woman's reproductive life, the aging process, and that the chart here shows the 3 stages of postmenopause. And if you take a look closely to the green shaded area, it corresponds directly with the blue shaded area. Menstrual cycle quality is dependent upon estrogen and progesterone levels. So the longer a woman goes without estrogen, the more damage that takes place to her tissues and organs. The short answer here is, in stage 1, the sooner you realize that this is a possibility for you, the better. You want to start it before there's been a lot of tissue damage due to estrogen and other hormone deficiencies. And because there will be a resurrection or restoration of organs and tissues. And this is done very carefully. So we never really know how damaged people's organs and tissues are, but we have a pretty good idea because they've been estrogen deficient for a while. And so when you restore estrogen and progesterone, this tissues and organs rejuvenate. And that's one of the ways that the body feels better, as I mentioned. And the goal is to get this full restoration so the brain and body comes back, and with the least amount of negative clinical indicators. So that's why stage 1 is better than stage 3. If a patient starts in stage 3 postmenopause, well, a patient has more tissue damage, and the practitioner has to be very careful here in stage 3. So there's more things to take into consideration with stage 3 postmenopause as a doctor would in stage 1 or 2. Because women usually in stage 3 postmenopause are older, and starting menopause reversal may not be a good idea for women who've never been on HRT, who are 70, 80, 90 years old. They may qualify for a low dose protocol, which will help them feel better than they do, but we may not be able to do a full restoration due to the tissue damage.
So that leads me in actually to some of our listener questions. I'm going to ask you a couple that all seem to go together that I think are picking up on what you were just talking about. So the first part is, can anyone reverse menopause? How old is too old to start HRT? Have I missed the boat? Can you kind of talk about that based on what we're talking about here today of reversing menopause?
I can break those 3 questions down actually incrementally. Can anyone reverse menopause? No. Some women are just too far gone. They're too old to even try to that degree. We
And
would,
is it old in terms of age or in terms of health?
well, yes, if you take a look back at the stages of reproductive aging, that that chart really has nothing to do with age. So it's a good point, Maggie. It's not necessarily about age. It's how long has a woman been estrogen deficient? How long has she been without estrogen? And so let's just say a woman has been on HRT for years, but she wants to restore a healthy menstrual cycle. Well, she has a better chance of a better result to get the clinical results she's looking for because she hasn't been completely depleted for years. And there's some young women who have never produced healthy estrogen, and their tissues and organs are just shriveling up. So basically, it depends on the overall health of the woman, how long she's been hormonally deficient is really the two things that we take a look at. So not everyone can. And how old is too old? Well, to quote Dr. Robert Wilson, women need estrogen from puberty to the grave. And so even though a woman can't reverse her menopause when she's 80 or 90, then she can benefit on an HRT system. So no woman should ever have to live a day of her life without estrogen. And have I missed the boat? Well, it depends on how deficient, how long a woman has been without. So if you're a woman asking this question, have I missed the boat on HRT? I've never been on HRT. I'm say 60. Can I start? Well, yes, we can actually reverse menopause for most women in their 60s. And, it just depends on the overall health of the woman, how long they've been hormonally deficient, how much tissue that equals how much tissue damage has been done to the body. So the doctors need to be trained on how to navigate this with older women. But yeah, most women can reverse menopause.
So, along those same lines, how long can a woman be on HRT?
Until they die. But some women don't want to have a menstrual cycle in their 80s or 90s. And then we would change the protocol. But if you lower the protocol, you don't get the same results. So there's an adaptation to this. And that's part of what the coach does, is explain to the patient what their experiences will be like if they choose this route or if they choose this route. And so if a woman wants to maintain not necessarily the menstrual cycle, but all the benefits, all the mental health and physical health benefits that therapeutic dose offers a woman without the menstrual cycle, then we can talk to them about an ablation or a hysterectomy, because they don't want to give up what they get with the estrogen. And so they're more apt to say, okay, yeah, get rid of my uterus. If I don't have to have a period, and that's the big problem here, then I want those hormones because I don't want to live with depression. I don't want to have anxiety. I want to be able to sleep at night. I want to be able to have a libido and sex when I'm 90. And women have that choice.
So, Marie, this is part of your coaching expertise, is helping women reverse menopause. Can you just share a couple of cases where women you've worked with have reversed their menopause successfully and what that's been like, what you've seen?
Certainly. Let me start with Tracy. Tracy's 52 years old, and she was about right at that 1 year mark of not having a period. And she came to me, she thought she was going to lose her job. Younger people were coming in. Her brain wasn't working, and she just felt like hell every day. I mean, every time I talked to her in our meetings, she was just in tears. Her journey was really interesting because she's what's considered a category 4 patient, and you'll learn about clinical categories in another episode. But that means that she has a lot of work to do with regards to her diet and lifestyle to bring her up to speed to be able to tolerate therapeutic dose hormone replacement therapy. But as she was going through this and she changed her diet and her lifestyle, and the hormones helped her through this process to get the motivation to work out, her brain and body started to work differently. She got her period back, I want to say in about 4 months, her period was regular. And right now, they're making her now ahead of her department. The people that were thinking about firing her changed their mind, and her brain is working. She's losing weight, and her body is just changing composition. When you take hormones that mimic a woman in their reproductive prime, the body naturally wants to reshape itself to mimic a younger reproductive woman for the purpose of reproduction, even though she won't be able to reproduce. So I mean, even Tracy's like, I cannot believe that I will never go through menopause in my life. I mean, all my friends are going through this, and I'm just like, hey, they're complaining about all this. And she was saying that I don't even want to hang out with them anymore because now our lives are different. I'm not in that in that place any longer. So I can't even relate to what they're saying. So that was interesting. And she's very typical. And then there's Shelly, who is 72. Shelly was a very healthy woman most of her life. I mean, she taught yoga most of her life. She lived a good farm to table diet. She exercised, meditated. She did all the right things her entire life. And I believe she was on a low dose estrogen at this time. So she was deficient, but she wasn't completely dehydrated internally. And so she started taking hormones, and it took her it takes about 3 to 6 months to get that menstrual cycle coming in, so there's no real problems with that. So her brain is working better and her body is reshaping. And what's interesting, no matter whether the woman's 42, 52, 62, 72, 82, the same level of estrogen sends the same message to the brain of the woman that she should be in her reproductive prime, which means she should be healthy. She should be happy. She should have a libido. She should be sleeping. She shouldn't be in pain. She should have a good sexual response. I mean, and she should be able to cope and not fall apart at the drop of a hat. And so this is what the hormones are telling the body to do. And these are the things that women experience as they go through this. And that's why it's just shocking to look back after you've kind of gone to that sweet spot. It's like, oh my gosh, this is all I needed all along was estrogen. I was put on psychotropic drugs for years, told that I had this depression, and it was estrogen deficiency that caused this depression. And so, yeah, there's a part of this transitional process is women getting a little upset when they realize all along this is what they've needed. And this is why I do this, because women have more control over how their brains and bodies age. And so Shelly, being 72, when I talked to her, and I asked her, do you think you'll ever get off the hormones? And she says, over my dead body, there's just no way I will ever get off these hormones. And I asked them, does it bother you to have a menstrual cycle? And they're like, oh, hell no. Are you kidding? If that's all I have to do for this, I can tell you story after story, but I'll tell you something. All these stories are the same. Women experience a very similar transition when they go through this. This is why we know it's going to happen at every juncture of this process. It's very predictable. And this is why I don't understand why this isn't standard of care medicine. Doctors shouldn't have to just stumble upon this. It should be taught. Women should have all of their hormones fully restored before the brain and body completely shrivel up into nothing. We shouldn't keep women estrogen starved. I think this is a real crime, and women need to stand up to this. Women need to know that they can actually control whether they experience menopause or not. So if you're in menopause and you want to learn if reversing menopause is a thing for you, or if it might be a good fit, book a discovery session with me. Go to advancedhormonebalancing.com and let's talk and see what your situation is and if you'd be a good candidate for this. It's not for everybody, but it is for most. I mean, could you imagine what a life would be like if you never had to worry about menopause or the side effects associated with it? And if this episode resonated with you, then subscribe to the channel and share with your friends who you think would benefit from this podcast. If you have a question you'd like us to address on the show, feel free to DM me or go to menopausemoxie.com/podcast and fill out the form and let us know the questions you'd like us to answer. And remember, everybody benefits when your hormones are balanced.